In the world of medicine, the term never event carries immense weight. It signifies an error so egregious, so preventable, that it should never happen. Retained surgical items, or RFOs, fall squarely into this category. These incidents involve surgical instruments, sponges, or other materials being accidentally left inside a patient's body after surgery. The consequences of RFOs are significant, leading to pain, infection, repeat surgeries, and even death. Patients place their trust in healthcare providers, and any breach of that trust can be devastating. Beyond the physical harm, RFOs carry a substantial psychological toll. Patients may experience anxiety, depression, and a loss of faith in the healthcare system. This understandably erodes trust and can have long-term impacts on a patient's well-being. The financial burden of treating RFOs is also considerable, adding further strain to already stretched healthcare resources. The Saudi Patient Safety Center, or SPSC, has been diligently tracking RFOs as part of its commitment to improving patient safety. Recent data paints a concerning picture. In 2024, the SPSC reported over 150 cases of retained surgical items in Saudi hospitals. While this number may seem small compared to the vast number of surgeries performed annually, each case represents a preventable error with potentially life-altering consequences. The most common types of retained objects were surgical sponges, followed by instruments like clamps and scissors. Abdominal surgeries, particularly emergency procedures, accounted for the majority of RFO incidents. This highlights the need for heightened vigilance during complex and time-sensitive surgeries. The SPSC data also revealed that communication breakdowns within surgical teams were a major contributing factor in many cases. Understanding the root causes of RFOs is paramount to developing effective prevention strategies. While human error plays a role, it's crucial to remember that healthcare professionals are humans working in often high-pressure environments. Factors such as fatigue, poor lighting, and time constraints can all increase the likelihood of mistakes. Communication breakdowns within the surgical team, particularly during handoffs or when there are changes in personnel, are also significant contributors to RFOs. Another factor is the lack of standardized surgical counts. In many cases, the surgical team may not have a clear and consistent system for counting instruments and sponges before, during, and after the procedure. This lack of standardization can lead to confusion and increase the risk of an item being left behind. Eliminating RFOs by 2025 is an ambitious yet achievable goal. It requires a multi-pronged approach that addresses both human and systemic factors. One of the most effective tools at our disposal is the World Health Organization's Surgical Safety Checklist. This simple yet powerful checklist prompts surgical teams to verify critical safety steps at key points during the procedure, including confirming the patient's identity, marking the surgical site, and conducting surgical counts. Another critical strategy is the 4Cs approach: communicate, count, confirm, and control. This involves fostering clear communication within the surgical team, implementing standardized counting procedures, confirming counts at multiple stages of the surgery, and controlling the surgical environment to minimize distractions. Technology also has a vital role to play in preventing RFOs. Radio frequency identification, or RFID technology, for example, allows hospitals to tag surgical instruments and sponges with tiny microchips. These chips can be tracked in real time, ensuring that no item is left behind. While the benefits of RFID are undeniable, implementing this technology does come with challenges, primarily cost and the need for staff training. However, the cost of implementing RFID must be weighed against the significant financial and human costs associated with treating RFOs.